Did you just say your turtle got kidnapped?
Welcome to the Beyond Beauty Podcast with Dr. Corey Gaiser and Dr. Troy Pierce. We're going to take you behind the scenes of cosmetic surgery and cosmetic dentistry.
Yeah, well, he got loose and then somebody picked it up, but apparently multiple people stopped. And the person that took it said that they were taking it home to breed with their tortoise. Instead of trying to find the owner and, returning it, they're going to take it home and start a tortoise pet shop. I don't fucking know, but
like Ernest P. Worrell. Did you ever see that movie?
Yeah, long time ago.
You see Ernest goes like the turtles, like with the parachutes, like coming down, like start a whole turtle army.
Oh, this is
I think it's this
big.
big.
This big, and he's 45 pounds.
Yeah.
I called the police to try to get traffic footage, and I've been going around and around. But anyways,
My gosh.
yeah.
Well, a day in the life of Dr. Gaiser. Right?
Turtle nappings and
You get the turtle nappings. Called Dog the Bounty Hunter for your tortoise.
well,
That's really sad. I'm not trying to laugh at that. That sucks. That's your
well,
pet.
it was an African American gentleman in a white van. So at least we got that, and we can kind of piece together.
Oh boy, it narrows it down, doesn't it? Listen to this. So yesterday, one of the doctors in my practice got a call around 9:00, and it looked like something was wrong, and my partner was sitting there, and he was kind of listening to him a little bit, and I didn't think much of it, and I came back, and guy's gone. I'm like, what happened to Dr. Barry? He goes, he had to leave. He got a phone call from somebody stole his license number. And I'm like, what? Yeah, I overheard they said that it could be months before he gets his license back reinstated. Like somebody stole his DEA. And I'm like, what?
Still a DEA.
I'm like, hold on. He said, yeah, something was wrong. I said, well, where did he go? Like a police station? He's like, maybe an attorney's office. I'm like, something sounds weird. Well, he had to leave. Nobody hears anything. He was just scared to death. And come to find out towards the end of the day that 20 people, dentists, had called the Ohio State Board because someone had gotten hold of some information of their license numbers and their personal information and tried to scam them, wanting money to reinstate their license automatically and things like that. So, I mean, what a freaking crazy world, right? Like we also got to do with that, right?
That was going around in the medical licenses too, because the American Medical Association has sent out notifications like, we will never call you to reinstate your license. Like if you get a phone call, do not give out any information.
Wow. I just wish that I had heard that phone call, because I would have told him, I'm like, nobody's going to tell you to put down your drill. Okay.
Right.
Unless they come in here with handcuffs. All right.
Yeah.
So, man, he was stressing out. The whole team was shaking up because they didn't know what was going on. I'm like, man, it's just a crazy world right now. I feel like, there's so much stuff that our patients have to put up with too, with their kids and social media and stuff. I mean, you never know where somebody comes from that day. They come in, you think they're having a bad day. It might just be that they just heard some bad news. So you gotta always have
or
that.
Or their tortoise got kidnapped.
Tortoise could get a kidnapped, for Christ's sake, like, oh my gosh. That's kind of what leads us into our little topic today. So here we are. Welcome to the latest edition of the Beyond Beauty Podcast with Dr. Gaiser. We have a couple episodes now under our belt, so I feel like every time we sit down and record, things will change, adapt, pick up a little bit, and also a little life fill-ins. I think those are fun. If you're looking for an intro, like that might be a great intro to just what crazy shit happened to us in the last week, right? So the topic for today is open up. there's like a funny like little reel or whatever in TikTok. I'm not on TikTok much, like ever. I know you. We'll talk about TikTok soon, but social media is fascinating to me. But I saw this one. It gets people sending me stuff all the time, and it's like the dentist lays you back and he says, "Open up," and they say, well, my wife just left me. My tortoise got stolen. Somebody tried to steal my license number yesterday. You're like, whoa. I just been like, open big,
Yeah.
So today is talk about maybe a little bit about that doctor patient kind of confidentiality that's so important. And people are divulging all kinds of health history and insecurities about what they are dealing with. And, sometimes that kind of spills over and they're telling you just everything. So I've heard some crazy stuff before. And also I've heard some stuff that's alarming and that, you may be the only person they get to talk to.
Yeah.
A lot of times I feel like patients, sometimes are lonely and they need, somebody to lend them an ear a little bit and get some stuff off their chest. And I think that goes into helping build confidence and build relationships, rapport with our patients. So, do you see that too in your day to day?
Oh, absolutely. Yeah, absolutely. And the nice thing is about my background is I was very comfortable talking to patients about taboo subjects, touchy subjects, maybe subjects that would make the average person kind of uncomfortable. Yeah. And so I'm very comfortable in that environment. And I think that makes for a much more personable experience for the patient because they are seeking your service for a specific reason, and I think it's a lot of times very individualized. And it may be something they don't want everybody to know, or maybe something that they're embarrassed of, relationship issues, whatever. And so it's easy for me to engage in those conversations because that was part of my training. Originally, but I think it's a huge component of what we do. So
I think there's a great deal of psychology that is behind working with people, and then working with people in healthcare, and then working with people in the cosmetic industry with elective care.
Here's the funny thing, and this is what people fail to understand. I think it's the general public, because we're so caught up in social media, we're so caught up in image and putting out this image of perfection, right? Is that we're all human. We all have embarrassing moments. We all pee and poop and all those things that we find, oh my God, it's embarrassing. I farted. We all fart. Hey, but people fail to recognize that. And they feel that we all have sexual issues. We all have emotional issues, right? We try to hide it because we have an image we feel like we need to uphold. So
that is true. I think we're looking at everybody's highlight reel, on social media. And I heard someone tell me that 80% of selfies taken in social media are filtered out for the purpose of their smile. And then you got filters that do their hair and their complexion.
Oh, you can do your cheekbones, right? Everything.
Like I said, I'm not big on, I don't even know what Snapchat does, but like TikTok, like I am mainly on Instagram and a tiny bit on Facebook just for family and stuff. So there is a huge portion of the population that has some insecurities about things that they don't want to talk about, and so we're not just providing a service or a crown or a veneer or even liposuction. Sometimes we're there as a coach to help them identify what really is going on, and some of that for you, I'm sure, is beneath the cosmetic surface, more just optimal health, getting your diet right and your exercise level, getting your stats right and your blood work, and then expectation level for your for the procedure you're looking into. Same thing here. Sometimes veneers aren't going to correct the other, maybe your nose is crooked. I can't make your teeth straight if your nose is crooked, type of thing. There's so many things that we're looking at in the cosmetic world that we try to just, hey, let's take a step back and say, like I had a patient yesterday who came in and she's been through orthodontics, and she has a cant through her smile like this. And, her eye line her pupillary line, we call it, is here. And you like your smile line to be parallel, and hers is crooked. So we're talking about how we grow, growth and development, like orthodontics and things like that, to really understand, your lips aren't crooked. Your teeth are kind of this way. So your gums are this way. And just an educational kind of, of why we're dealing with what we're dealing with and what we can do to correct it.
Well,
a lot of stories.
That's an important concept, I think, because some of the times we just want an answer for what's going on. We may not necessarily need correction, but just why is what's going on the way it is? We seek out improvement or correction on it, and then you get an answer of why things are the way they are. And it's, oh, okay, well, I guess I'm okay with that.
Yeah. Because there's multiple ways to correct that. You could go through, you go to an orthodontist, you're going to get a different treatment plan than what you would if you come to my office, because I'm going to give you both scenarios, and the outcome can be similar, but the way you get there is very different. And sometimes I guess that's in cosmetic surgery too. You could liposuction and do this, or you could hit the gym for 90 days and get us, but sometimes I feel like people would appreciate the head start. That's what I feel like, if they're looking at improving their outwardly appearance, starting with their smile helps build on other things. And sometimes that's what they need to hit the gym.
Oh, yeah.
Sometimes I would imagine that's the same way with liposuction too, just to give you a little bit, maybe you just feel better and more confident. Now you can go.
Well, yeah, we talked about that confidence last time. Get that confidence boost. Now I can walk in with my head held high and really get down to what my other focuses are. We do a lot of liposuction for the purpose of jumpstarting a person's weight loss. We always say liposuction is not a weight loss tool, but it's going to get me motivated. Now I see a physical change. Mm-hmm. Now I'm motivated. I'm confident. Let's do this.
Mm-hmm. That's the hard part about going to the gym. It's the, 3 to 6 weeks of going and not seeing those results. But then when you do, now you're motivated to go back.
Right.
Just getting over that hump, getting in the routine and seeing a little bit of progress to help motivate you to get back there.
We're such an instant gratification culture. I want it right now. And I don't think that's necessarily a bad thing, but when it comes to something that takes time, takes time based on the physiology of it, weight loss in the gym, it's going to take time, but I want to see results now.
Yep. Lady came in, we were just finishing up her Invisalign, but her first consultation was for veneers. And, after she had her educational examination, we have an hour we spend together kind of helping sort through what's the origin of the problems that you see. And she went home with a treatment plan to do veneers, and she called me back the next day and says, you know what, I think I want to do Invisalign. I'm like, there you go. Now, since you were able to understand what's going on and know that there's multiple ways to correct it, you're going to save yourself a bunch of money by doing Invisalign versus veneers. It's more conservative. And what's wrong with having a nice, bright, healthy smile that's, corrected in terms of orthodontic, and you may be able to get veneers down the road, but now you put yourself in a position to get the results that you really wanted, a much more conservative route. So a lot of times I know I tell patients this a lot, like I'm pumping the brakes on someone who comes in ready to go. Like they want that smile, they want it now. And I'm always kind of like, all right, let's think about this a little bit. Let's go through the steps,
right?
This examination process and see what really are our problems, what our expectation level is going to be, bring a budget into there, and then see what you think.
And that's the difference between a good physician and a quick money grab, right? So we're gonna work through this problem, figure out what the issue is that we're attacking, and how many ways can we do it, and what's the best for the patient.
Yeah. What I've seen is that when you have the patient's best interest in mind, that always comes back tenfold.
Oh yeah.
I'd much rather have a patient for life and that refers me someone every month I mean, because those kind of relationships build like that, and they just talk, and that takes care of itself if you take care of people first. I feel like,
and we've talked about this before, that this industry is full of sham treatments. You know, it's easy to do a quick money grab, make some money on a patient, and move on. They know that. They know when those results didn't last or they didn't
right.
get results, and they're not coming back. You know, but you give them some education, you give them some guidance, and you got a friend and a patient for life.
For sure. So what are some of you told me you started off the story today with your tortoise being stolen. You've got a tortoise was kidnapped. Now, this is no ordinary turtle you see in your backyard. This thing's like 40, 50 pounds.
Yeah.
What kind of?
Big, it's a sulcata. It's an African sulcata tortoise.
Okay.
And he broke out of his pen yesterday.
What's that look like, you think, as a tortoise breaks out of prison?
They're very strong. They're big, because they're burrowing tortoise. They live in burrows underground.
Got it.
And so they're very strong. You managed to get the gate open and made it to the road. And somebody stopped. Multiple people stopped, apparently, and the one person picked it up and vocalized to everybody else that had stopped that he's going to take it home to breed with his tortoise. He knew what it was. He apparently had sulcata tortoise, a sulcata tortoise himself, and took off with it. So instead of trying to find the owner,
there's no place you can hide a big tortoise like that. So we're gonna find your turtle.
I think that's
definitely a unique story. I've heard. I haven't heard one of those lately. So what are some of the other, like, you have any like memorable like confessions or kind of like off the wall comments that you've ever heard from somebody that comes in and you say, all right, and then they start just going off on some tangent? Anything off the top of your head kind of stand out? Untold stories of the cosmetic world or anything like that?
I mean, we hear because we do hormone replacement therapy too. And so we hear a lot about sexual dysfunction, both in men and women. You know, no specific story comes to mind because everything kind of just blends over time. But
your threshold for what might seem odd probably is like different.
Yeah.
Right?
Yeah. Because, you know, the funny thing, and this is what people don't understand, is you and I have experienced the average person has experienced most of these issues, right? That these patients are coming in confidence and talking about, not realizing that, hey, I've experienced that too. I'm an open book. I'm going to tell you, if I had an ejaculatory disorder or an erection disorder or a smile or something, you know, I don't care. I'm human. I know, you know, and I know the average person is experiencing something like that. And so we get a lot of sexual dysfunction, which is always difficult for the patient to talk about. I just jump right into it. Hey, you know, is the erection issue, the vaginal lubrication issue, is it, you know, tightness, whatever, and you take that stigma away from it. You know, let's just
you break the ice first.
And so nothing that stands out as like, oh my God, because there's a lot of, again, like you said, my tolerance or my threshold is
your threshold is different than mine. It's always to me like, well, I want to get my teeth done because I'm getting ready to lose his insurance because he went out with some bartender when we were on vacation. All right. So she calls me at the grocery. I'm at the grocery store. I've known her and her husband for a long time. And he sounds like he has a good time. So they went to Key West, and she called me, and all of a sudden she goes, Dr. Pierce, can you help me? So-and-so won't come back home. I'm leaving. We were in Key West for 3 weeks, and now he says he's not coming home. He ran off with the bartender. I can't believe it. What should I do? And I'm like, I don't know. This is not the emergency line for these kind of conversations. And she said, well, I was clenching my teeth because I was so stressed, and I broke a tooth. Can I come see you on Monday? I said, sure, come in. She goes, well, you know what? I'm just going to get all my teeth done. I want to use his insurance because I'm going to lose it. He's going to take it from me and all this. I'm going to take him I'm going to get me a new smile. So when he's off with that little tramp, I'm going to have me a new smile. And it's like, oh boy. And then you got to see then the husband comes in like, after that at some point, and I'm like hearing it from him and hearing it from this side. I'm like, look, I'm in the middle here. I'm just trying to, I'm playing it neutral. I'm playing it neutral. So man, that's one that I'll never forget. But gosh, I see him all the time, especially the people. I got this guy who sells like produce and vegetables. This old guy comes in with a sack of tomatoes. He's always coming in with this. He pays. He's not really trying to pay for it, but he just likes to bring me in vegetables and stuff like that. I don't mind that at all. I love me some homegrown tomatoes and stuff like that. So just little things like that. Like if you ever hear anything like something that stands out, bring it to the table here. Like I like to hear stories like that to see what people are doing, and just I don't know. I love just dealing with people, so it's kind of my thing.
We haven't had anything exciting like that. Usually, a lot of times the couples come in together, and I guess I'm good at playing off the energy in the room and trying to, like I said, take the stigma off of stuff. So, one person starts talking about the other sexual dysfunction. I like to take let's just break that down right now. It all happens with everybody. So don't point fingers, because
you said that you're real good at taboo conversations. Like, I think people would be surprised when they found out how many people out there have done cosmetic treatment or veneers or cosmetic, like a boob job or liposuction. I mean, I think it's just all over the place, and people just don't talk about it as much. Like, what do you think? Like, I mean, we're in Cincinnati. We're not like in Las Vegas or LA or Miami or anything, but here in central Southwest Ohio, whatever, like, can you speak on that a little bit? How prevalent do you think that cosmetic procedures are in this area?
Oh, very. I mean, a very large portion of people I know and interact with, even before we got into this industry, are involved in or receiving cosmetic treatment in some way, whether it's a neurotoxin like Botox or a filler. Those are the two most common. And it's funny because you see a pretty good split. Those that just don't care. Hey, I don't care. You can know I got something done. And then the other end of the spectrum, who's like, I don't want anybody to know. I'm coming in the back door. Like, don't tell anybody I come here.
I hear that too.
And it's funny because they walk. It's not my place to understand why they care necessarily, but it's like, well, why do you care if somebody knows that you've got a neurotoxin?
Yeah.
When you're 50 and they're 50, you're going to be doing much better in terms of aesthetics. And so you're going to be much happier. So they're going to be wishing they had done it instead of
absolutely. I have mainly the guys who don't want anyone to know that they got their smile worked on. They want to be healthy. They don't want things to deteriorate, but I don't want it to look so bold. I want it to be kind of, where nobody would notice.
Right.
And I actually had, I do a lot of virtual consultations, and someone will send me a photo of their smile and a little bit about what they want to achieve. And I give them back like a little customized 5 to 10 minute video. That's kind of how I intake new patients. And it's really helpful for them because they get some education on, some ideas before they come in. They're much further along the process of making their decisions. And I actually had a lady submit one for her husband. So it came through as a male, but in her little paragraph of what she was thinking, she's like, I'm doing this for my husband because he doesn't want anybody, he doesn't want to go because he didn't want people to make fun of him for getting his teeth fixed. He works his butt off. He's a mechanic. And, guys are kind of, they hold back a little bit, I think. What do you think?
We're like on the tail end of this stoic masculine culture that, I think we've come a long way in terms of being able to address I don't know if you want to call it the more feminine, I don't think it's an appropriate term, but stuff in the aesthetics or cosmetics industry in terms of men getting treatment, but there's still this population of men who are just, I'm not getting that.
Mm-hmm.
Oh, okay. Well, I mean, that's cool. But, I consider myself a pretty manly man, if you will. I hunt, I fish, I own a lot of guns,
You've got farm animals in your house.
Yeah, farm animals. I get laser hair removal. I get Botox,
Yeah.
so okay.
Yeah.
Make fun of me if you want. That's okay.
Yeah. Yeah. Well, wow. When I went over to your office, I was talking, you mentioned some things to me about hormone replacement therapy, and I've heard about exogenous testosterone. And when I started hearing about the physiologic benefits of maintaining your testosterone or having a higher testosterone level at certain points, and it decrease your chance of cardiovascular disease by like dramatically.
Yeah.
All these deterioration of organ systems, like osteoporosis.
Right.
I mean, you name it. Testosterone
disorders. And it's funny because on that topic, I think the healthcare industry has failed us in that respect. I really do, because I'm coming from an internal medicine perspective. I feel like that's a taboo subject in the physician's mind. We're trained to look the other way when it comes to hormone deficiencies in the middle to advanced age patient. Why? This is the patient that needs it the most.
Yeah.
We don't. We have all these stigmas. Oh, it causes cancer. It causes these issues.
That's going to be the link to the longevity. I feel like when people are saying like, the first person to live to 140 years old is alive now. And I think that happens with, proactive medicine, things like that. And, they say the first half of your life, you take advantage of your health for wealth. And then the other half of your life, you spend that wealth on your health. How about we reverse that?
Yeah.
Put that, to work for us early in life so that we can get the longevity that we're looking for, not just to live longer, but to be active.
When you look back at the last 20 years, stem cell therapy has really ramped up its popularity. And now you're starting to see a shift from stem cells to exosomes, to things that we can better grasp. We have at our fingertips. I can order exosomes, and it's equivalent, if not better, than stem cells. And so there's the regenerative, restorative medicine aspect that's going to play a factor in our longevity, in our aesthetics health, in our mental health. It's at our fingertips, and it's only getting better. So.
Wow.
I think you're 100%.
I don't even know what that is. So we'll have to talk about that sometime, but for sure. So yeah. So there you go. We're always having some interesting topics to talk about. I love it. I think it's super helpful for our audience. I mean, this is stuff that everybody deals with every day is their self-confidence, and maybe their appearance is a part of that. And there's so many things that we can do, from hormone replacement to Botox to help your smile get leveled out with porcelain veneers. I mean, there's so many different things out there. And sometimes it's just, going and having a routine visit with your physician and checking in and making sure you're healthy. I think it all starts with health, right?
Yeah, absolutely.
Good deal, man. Anything you wanted to add on any of those topics today? Anything?
Just for the average patient listening in, don't be afraid to go talk to somebody about this stuff. Whether it's masculinity or I need to be stoic, or if it's a cost issue. That's something I always discuss with my patients: is cost. I can't spend your money. So
yeah,
if you are on a fixed budget, you can still obtain these treatments. So, have that conversation, whatever's holding you back from obtaining that next step in getting better mental health. Go have that conversation.
Bring it up to your doctor, for sure. Well, man, I appreciate your time. Thanks again. Have a great week this week, and keep at it. I hope you find your turtle.
Oh, me too. All right. Until next time. I'll talk to you.
All right. See ya.